Just got back from Dallas Rhinoplasty, Dallas Cosmetic, and I wanted to talk to you about the meeting and the new things that I learned. So you probably know that Dallas Rhinoplasty, Dallas Cosmetic is a 3.5-day meeting held every spring in Dallas. It's a great, unique combination of lectures, learning about the latest, as well as cadaver dissection lab. So whatever you learn, you can actually apply in the dissection lab. There's also a world-renowned faculty. I'm not aware of any smaller meeting like this where you have world-famous people, the people who invented these procedures, who can actually guide you in the dissection lab, and you can ask tons of questions from them. So this year, I was honored to give a talk on AI and plastic surgery. I really focused more on the academics as well as some of the aspects of what it can help with in terms of patient education, content creation, or just making some of the dredge work of creating content a little easier. So it was a lot of fun. Now, in terms of technology, the biggest takeaway was the new InMode Ignite platform. So this is radiofrequency microneedling or radiofrequency technology, but this wand is incredible. Essentially, placing it underneath the skin, and you do not need to do liposuction necessarily, but rather just placing the Ignite InMode wand underneath the skin, you can actually hear and see tightening of skin. So it's pretty remarkable. This just came out, I'd say about a month ago, so it's pretty new, but it was very cool to see it in action, and it actually was very cool to see it in action in the cadaver lab. Essentially, it is radiofrequency, but it's faster, it's safer, it's more effective, it's more efficient. So kudos to InMode. One hot topic, as always, is preservation rhinoplasty. So basically, this is like regular nose jobs or rhinoplasty, except you're trying to preserve more ligaments, you're trying to do a little less dissection, so there's less swelling, and you're actually able to do all the same maneuvers that we do with regular rhinoplasty in a more sort of controlled fashion. Now, having said that, sometimes you're not in control. There's lots of different ways to approach this. So right now, I don't think it's necessarily the gold standard. I think they're still sort of clarifying and figuring out what's possible and what's not possible, who the best candidates are and who are not the best candidates. Certainly with traditional rhinoplasty, where it's open, where I need to make an incision in your skin, lift up the skin, and really look at everything, that's going to create more swelling because I have to do more dissection. However, since I can see both sides at the same time, this is really critical to get symmetry. Also, if it's your second or third rhinoplasty, I still think that this is the way to go as opposed to structural preservation rhinoplasty. Finally, there are a couple lectures on deep plane, one of my favorite topics, and so the deep plane, facelift and neck lift, Dr. Aston gave a great historical review, over 50 years of facelift experience. Honestly, I think that deep plane does help in terms of getting a slightly better look around the mouth, specifically the nasolabial fold and also around the jowl or jawline area. There's a big but. If you don't really need to have it done, why bother getting it done? So my feeling is that if you're a younger patient or a patient where it's simply not as deep, with other sort of techniques, I don't know if you necessarily truly need a full deep plane facelift. This is just my opinion. I love doing deep plane facelift. That by far is 90% of what I do today for facelift and neck lift. However, just because you have a hammer doesn't mean that everything's a nail. Well, just because I use this awesome term deep plane, that doesn't mean that in every patient they need a deep plane facelift, but I would say the majority of my patients do. So why do I love the Dallas Rhinoplasty, Dallas Cosmetic meeting so much? I think the biggest reason is because it's a smaller audience. So you can really hear the lectures, you're not gonna fall asleep. You can actually ask questions and get them answered, and it's easier to network with a lot of the speakers. With the cadaver dissection lab, this is another feature. So I'm honored to be one of the faculty instructors in the cadaver dissection lab, and it's fantastic because in the lab, we're able to follow along with world-famous plastic surgeons who literally invented these procedures. And on video, in the room, they'll guide you through how they exactly do it. They will walk around the dissection lab and then they'll answer questions around each group's concerns. And so this is a fantastic opportunity. Short of actually going and flying to see this plastic surgeon actually operate in their operating room, there's no better conference, there's no better way that I'm aware of to really figure out what's going on. In conclusion, this is a great smaller course for plastic surgeons. It's still pretty long, it is a time commitment, but it's a great way to actually learn the latest every year, to apply your actual lecture knowledge to cadaver dissection knowledge and then to your patients. And it's always great to see old friends every single year. So I strongly encourage you to go. Next year in 2026 is going to be from March 19th through the 22nd. So that's Thursday, March 19th through Sunday, March 22nd. So I'll see you in Big D.